Hi again, this is Sam Ali, and I'm here to present the curriculum planning or curriculum mapping that I am about to present. And this is for Curriculum Design and Teaching Strategies course. The topic that I chose from Healthy People 2030 is heart disease and stroke. And the reason I chose this is because heart disease is a leading cause of death in the United States, and the stroke is the fifth leading cause of death in the United States. Together, these two are the most expensive. We spend about $320 billion annually on these diseases. The good news is both of these diseases, or they're under one category, they're among the most preventable. So it's really important for the baccalaureate student to know first of all, how to treat these patients, how to educate them and help them prevent the disease. This is my map. We're going to delve into in more detail. And this is the references I just want to show before I go into the actual map, and we'll talk about it. Hang on with me. All right, so here's the map. And heart disease and stroke fits under the category course for Adult Health 1. The three objectives, course objectives that I picked for this topic is that by the end of the unit, the baccalaureate students will be able to implement safe and quality patient-centered nursing care for patients with heart disease and stroke. 2, they will identify risk factors, their effect on heart disease, their treatment, and preventions. And third, the baccalaureate student will be able to participate as a member of the healthcare team using mutually respectful communication and collaborate to develop the best patient-centered care. The three essentials that I chose that every baccalaureate program should follow under the AACN's essential. Number 1 is basic organizational and systems leadership for quality and patient safety. And this supports the objective number 1. Under this one, it is important that the BSN student understand the disease process, medication, and patients respond to medication. A little bit more details that the student will be able to identify signs and symptoms of MIs, for example, and strokes, and implement the proper protocol for each of these for best outcome. So it's important that they know that quick response it's the key in treating these diseases and for the best outcomes. So how they would do that is a student will be able to obtain data from EMR, lab values, lipid panels, troponins, etc., and then test results like EKG, echoes, chest X-ray, CT, MRI, and we'll be able to communicate that with the physician and the other team members. Using the education tab to initiate education, like smoking cessation, these are the modifiable risk factors for heart disease and stroke. Smoking cessation is one of them, diabetes, diet, weight reduction, stress management, etc. The number 2 essential that I chose from the AACN essentials is interprofessional communication and collaboration for improving patient health outcome. This helps and supports the objective number 3 for the students, is that baccalaureate students will be able to communicate, collaborate effectively with each with physician, cardiac rehab nurse, PTOT, diabetic educator, pharmacy, social work, case manager, and kind of use a whole approach in giving the best outcome for the patient and staying, helping them keep safe and healthy. And the third essential is clinical prevention and population health. It is important that the baccalaureate student will be able to identify social determinant of health, to identify individuals at increased risk for heart disease and stroke. And this is really important because it's important to set them up for the, help the patient have a better outcome, but not only just better outcome, but hopefully prevent a second stroke, because we know that second heart disease, second stroke, second heart attack, it's the deadly one. This essential supports objective number 2. The other thing is that students will be able to understand heart disease and stroke, their disease process, complication, identify the most modifiable risk factors, smoking like hypertension, diabetes, hyperlipidemia, obesity, diet, and activity, and educate patient and family to prevent that second heart attack or second stroke is the top priority. Then we're going to talk about the CUSUM competencies. The two I've chose that's very important for baccalaureate students to have is, number 1, I chose patient-centered care, and this supports objective 1 and 3, and that is understanding that the student will be able to understand that individual particular health needs in the hospital and home, increased patient satisfaction, increases patients' adherence to suggested lifestyle changes, prescribed treatments, better outcomes, and more cost-effective, for overall. And the other one I chose, the CUSUM competency, is teamwork and collaboration, and this supports objective number 3, and that is communicate and collaborate effectively with physician, like I said, cardiac rehab nurse, PTOT, diabetic educator, pharmacy, social work, case manager, and the whole team, again, to give the patient the best outcome. And then the 3 integral part that students should be able to is per NCSBN, and that is management of care. This supports objective number 1 and 3. And this is important. It says individual or the baccalaureate students will be able to deliver individualized patient care by understanding each patient's work, home, social situation, tailoring their care even when discharged to keep them at home and healthy and out of the hospital. The second one is using team approach and finding resources for patient access to medication, follow-up appointments, means of transportation to appointments, key in keeping patient healthy and safe after discharge. Again, preventing readmission and further complication is important. And then the second one is pharmacology and parenteral therapy. This supports objective number 1, is that baccalaureate student will understand medication safety, verify med orders, check patient's EMR for allergies, ask patient for allergies, prepare meds for one patient at a time to prevent errors from happening, mistakes, educate patient about their medication, and follow the 8 rights of medication administration. And last but not least is the third supporting body is the reduction of risk potential per NCSBN. And this supports objective number 2. It's important that the BSN students obtaining thorough assessment of individual history, social background, modifiable risk factors like we had talked about, and teach patients about how to prevent, how to make their lifestyle change so that they can not only not have another stroke, but have a good outcome after the hospitalization. And baccalaureate student will be able to identify cardiac complication and stroke complications and educate patient and family on how to prevent them. Preventing second episode is a key in preventing death and disability, and etc. So this was my curriculum mapping. I hope that you enjoy watching it. I really appreciate your time, and have a blessed day.